What happened initially was I felt I had a lump right up here under my chin. It continued to get larger and recommended that I get a needle biopsy, which is the insertion of a needle and they take a small amount of the tissue. And the needle biopsy that was about 14 months ago indicated that I had tonsil cancer, squamous cell. I was immediately referred to the University of Kansas Medical Center. They wanted to do, in fact scheduled me for, a radical neck surgery, which basically meant they were going to open me up from this ear to this ear and take out all my lymph nodes and salivary glands, the parotid glands, take out everything in my neck. And I was not very excited about that type of disfiguring permanent surgical solution.
Mm-hmm. And it was the only option they offered you?
It was the only option that that particular hospital offered. And I then decided to get a second opinion at MD Anderson Cancer Institute in Houston. Their second opinion was that surgery is not the appropriate option. They said they don't treat these types of tumors with surgery. They treat them with what they call induction chemotherapy for a couple of weeks, and then they use high-dose radiation, about 30-some rounds of high-dose radiation. But the option from MD Anderson was not all that palatable to me either. And the reason for that is because they said I had about a 30% chance of losing my mandible through bone necrosis or death of the tissue because of the radiation, correct, about a 30% chance. And which again would be, although the mandible possibly could be rebuilt to some extent, that is just a debilitating, just a permanently horrific situation. I would also have very limited movement of my neck, and because of the tissue damage from the high-dose radiation, and I would lose salivation permanently. I would no longer have saliva, which the implications of that are a lot more far-reaching than most people even begin to understand. And so, leaving MD Anderson, this was about almost to the day a year ago, I was desperate to find another option. I looked for anything, anywhere in the world. I didn't believe that the only options were the scalpel or this type of drastic radiation. It was just difficult for me to believe that I was pigeonholed or forced or compelled to seek that type of treatment. And I was willing to go anywhere, whether it be into the Far East, China, Singapore. I was willing to go to Europe, to Scandinavia, anywhere. How did I look?
Where?
I looked on the internet. I looked on the internet. And I was very fortunate to have, I believe, to have found the treatment option at Beecher Cancer Institute. I've had a healthy skepticism of the medical profession my entire life. Okay. And it's primarily because I believe that the body and its function is more holistic, to borrow from an oft-used expression. In other words, that the maladies of the body and the cures for those are more far-reaching than just simply surgery or some type of medical intervention, particularly medicine. Mm-hmm. And so I've always led a very healthy lifestyle, in my opinion, and which was to get a disease of this sort was really was astonishing. And like I was told at MD Anderson, you're perfectly healthy, you just have cancer. And that's actually quite true. The treatment itself is really quite easy. The hyperthermia, you can sleep during it. I tend to doze off. It's not painful by any means or at all. And of course, radiation, IMRT or intensity modulated radiation therapy, there's no pain involved in that at all. there are some side effects. Anytime you do head and neck radiation to any degree at all, you get dry mouth, and there are the other things. But there's medicines, mouthwashes, and other things like that can certainly mitigate the side effects, and that have worked out very successfully for me.